just a moment. Some more people coming onto Zoom. Welcome. And then hopefully there won't be much of a delay on Zoom and we can get started. Let me close a few windows here. Haven't had a delay like this in a while. So give me a moment. Okay. Apologize, we have some more people coming in. And looks like things are slow for some reason on Zoom and on YouTube. Maybe I have a bad connection. We'll get started in just a moment. Hey, everyone. Okay. Apologize, we have some more people coming in. Definitely a bit of a delay here. Sorry about that, the audio. Whoops. Okay, now let's go over back to YouTube and Zoom. Okay. All right, so things should be decent. Do let me know if there is a delay. Hopefully there isn't much of a delay and then we can get started. Someone could type into the box and we'll get started. If it's just a second or two, but the audio is fine. Okay, all right, so welcome everyone. This is episode 76 of Wednesday Night Live. And for those of you who don't know, I am the president and founder of Miracle Noodle. And every Wednesday night, we call this Wednesday Night Live, we do a health topic. In this one, I'm doing a talk about hair loss. And the reason I'm doing a talk about hair loss is one, because I happen to be a board certified dermatologist, and two, it is something that causes an enormous amount of anxiety among people. It is one of the things that people worry about in terms of their appearance, almost more than anything else. Hair loss can be an incredibly stressful thing, both in men and women. And tonight we're going to be talking about the different types of hair loss and different types of treatments, as well as some lifestyle considerations. And a lot of people, take notes essentially with this type of talk. So I'm going to be sharing my screen, and on the screen will be listed a whole host of suggestions for people who are watching on Instagram. Don't worry about that. Everything will be very easy for you to follow and understand. And certainly, if you want to reach out to me afterwards through Miracle Noodle, I'll be happy to share the lecture notes as far as different lifestyle suggestions, supplement suggestions, whatever the case may be. So let me share my screen and we will get started. Okay, so you should see my screen now. Hopefully there's not much of a delay there. And let me blow this up a little bit. And tonight we're going to be talking about hair loss, hair thinning, and a specific type called non-scarring. Now, there are lots of conditions that can cause scarring of the scalp, things like lupus and a whole host of scar. We're not talking about that. We're going to be talking about general hair loss, thinning of the hair, both in men and in women, and some of the things that they might have in common. We'll start with one particular condition that we see quite a bit, called alopecia areata, and then we'll move on to talking about women, specifically hair thinning, female pattern, androgenetic alopecia. So that's sort of like a genetic type of alopecia. Alopecia being a word that means hair loss. And then we'll get into men, and we'll also talk about male pattern baldness, as well as treatments that are involved. And also we'll talk about lifestyle suggestions, diet suggestions, both in men and women, as well as various supplement suggestions as well. So when we start talking about hair loss, there is actually a very different distribution of types of hair loss when it comes to the difference between men and women. There's one type of hair loss that we see very, very commonly, and it's called alopecia areata. And alopecia areata is a condition where people get these circular little areas on their scalp that are completely bald. It's incredibly common. You have a 1.7% lifetime risk of having it. That may seem small, but it actually makes up, in terms of a dermatology practice, a fair number of people. It ranges in severity. Some people just have these circular tiny little spots, and others, unfortunately, can have what's called alopecia totalis, where unfortunately they lose all their hair. And there's alopecia universalis, where people lose, unfortunately, hair from their head to their toe. And a lot of people don't realize how important your hair actually is. For example, with people who have alopecia universalis and they lose their eyelashes, it's very difficult, believe it or not, to keep dust and things out of your eyes. So your eyelashes are incredibly important, as are your eyebrows. People who have unfortunately lost their eyebrows realize how functional they actually were before, which basically means things dripping down into your eyeballs. We don't really think of our eyebrows as being these functional parts of our body, but they actually provide an enormous amount of protection for your eyes, believe it or not. And in the human body, as all of you know, is really just incredible when it comes to protecting itself. And really, when you learn about the human body and you realize how important your eyelashes are, your eyebrows, and your hair in general, you really start to understand how incredibly amazing it is. So alopecia areata is this condition where you get these little, for most people, they get these small little circles. For those particular people, it usually goes away within a year. And for that condition, it's very easy to treat, and it's treated with little injections of cortisone into the scalp. For my patients, I recommend that they supplement with zinc. The zinc will come up several times in tonight's class, because zinc is important for the skin, hair, and nails. And we know that zinc is also very important for your immune health as well. The key is to make sure that you're not taking more than 15 to 25 milligrams per day. There is a reason for that, because zinc and copper go hand in hand. And if you don't have them balanced out properly and you take too much zinc, you can actually have problems with your copper. There's so many things that interact in the body. So I recommend for people who have alopecia areata to take 15 to 25 milligrams of zinc per day. You can check your multivitamin to see if that's in there, and also to check vitamin D. And vitamin D, actually, when I was in training, vitamin D wasn't something that we commonly checked, but actually it does play a role in overall skin health as well as hair health. And therefore, checking vitamin D is very important. Now, if you've been listening to my classes over the last 76 weeks, you know that I think everyone should know what their vitamin D level is, and it should be above 40. And hopefully everyone listening knows what their vitamin D level is. If they don't, you can actually ask your doctor, or you can order it yourself from the many labs that allow you to order your own labs. Or for vitamin D, you can actually get a kit where you actually do a finger stick. And that finger stick allows you to put a little blood on the little spot and then send it in, and they can tell you your vitamin D. So there's no excuse. You really should know what your vitamin D level is. For some people, you can get generalized hair loss that comes back when you have rashes in your scalp. So people have psoriasis and bad dandruff, you can actually lose a little bit of your hair. Now that is non-scarring, which means that once you get rid of the rash, the hair will come back, usually just as full as it was before. So this is something that's incredibly common. Now we're going to jump right into women, hair loss in women, and I'm being very ambitious covering all of hair loss in men and women, but we'll spend an hour together tonight, and we'll try to go through as much as we possibly can. And if anyone has any questions, definitely type them into the chat box on Instagram. You can type them into the comments. Same on YouTube. Okay, so we're going to start with something that is very, very common now with COVID. believe it or not. And the name of this is called telogen effluvium. It sounds weird, and I'm going to explain what that is to you. And it really is going to give you an idea of how the hair grows. My YouTube channel is youtube.com/jcarp, JCARPMD. That's my YouTube channel. All right, so let's talk about telogen effluvium. Now, it's important to understand that this is a stress-induced type of hair loss, and it's something that we often see in situations of sudden stress. And the important thing to understand here, which I think is very interesting, and I think most people find interesting, is that the hair goes through 3 cycles of growing. There's a growing phase, there's a resting phase, and then there's a shedding phase, which basically means that when you have one hair, it can't grow forever. It's only going to grow for a certain period of time. And that anagen phase, that growing phase, really can only last somewhere between 3 and 5 years, which means that one hair can really only grow for 3 to 5 years. Now, there are people who just genetically have a longer growing phase and can grow very, very long hair. As you get older, this growing phase really starts to shrink, which basically means that maybe when you were a little girl, you had a growing phase that was in the upper level of that 3 to 5, maybe even six years. And remember, there was, what was that country singer? Crystal Gayle used to have incredibly long hair down past her butt. Well, the issue is that she had a naturally long growing phase, which basically means that maybe she had a 6-year growing phase, way, way beyond the normal, which means that one hair could grow for 6 years. And so as you get older, your phase starts to shrink, which is the reason why you don't see older women with long hair and ponytails and braids. The reason is because the phase, that growing phase between 3 to 5 years, starts to shrink, starts to shorten, and therefore you can't grow one hair a long period of time. Now, there are other phases. There's a growing phase, then there's a resting phase, and then there's a shedding phase. The resting phase lasts on the order of several months, 3 to 5 months, and then the shedding phase basically lasts for several weeks. And that's basically what's happening. So what's happening is when you have a sudden stress, generally your hair is the growing phases are rotating all around your scalp. So a large percentage of your hair, of course, is in the growing phase, and a certain percentage of your hair is in the resting and shedding phase. That's why we're constantly shedding a certain amount of hair, on the order of 550 to 200 hairs per day is natural for people to actually lose. Now, what happens when there's a sudden stress is that the hair that's in the growing phase abnormally shifts into the next phase, which means that if you had a large amount that was in the growing phase, it's now heading into the resting phase, which can last 3 to 4 months. And unfortunately, what happens at the end of that 3 to 4 months is it goes into the shedding phase. So while we might have a small percentage of our hair rotating into the shedding phase, now because of the sudden stress, we have a large amount of hair that's going into the shedding phase. And when it does that, all of a sudden, 3 to 4 months later, it falls out. Now, that is basically what happens sometimes in cases of COVID. COVID lockdown has caused that. We saw an enormous amount of telogen effluvium during lockdown. General anesthesia, death in the family, so any sort of sudden stresses, childbirth sometimes can cause that. 3 to 4 months after giving birth, a fair number of people can actually have shedding of their hair. The important thing to understand about telogen effluvium, this sudden stress that 3 to 4 months later results in a lot of hair shedding, is to understand that several weeks later, there's going to be new hair that's going to come in. Because remember, that next phase is really only going to last several weeks. And so the hair is only going to fall out, for around a month, 2 to 5 weeks maybe. And then all of a sudden everything will start to regrow as the cycles become more normalized. And that's basically what's happening with telogen effluvium. So you really just sort of have to wait it out, but you do have to understand that while this is happening, unfortunately, 2 to 4 months, usually 3 to 4 months after this sudden stress, you can get a sudden amount of hair loss. Next, we'll talk about androgenic alopecia. This is basically like male pattern hair loss in women. It's associated with androgens, with hormones, and is associated with several other conditions, especially when a woman comes in with thinning of the hair that is identified as what we call androgenetic alopecia. We wonder if there are some other things going on. One is polycystic ovarian syndrome. So many of you are aware of that. We've spoken about that quite a bit. And this can cause a whole host of things, but there are other associated things. We'll talk a little bit more about PCOS as we go through the class. As far as scalp massage, someone's asking on Instagram, absolutely, scalp massage. You'll understand as we go through the treatments that scalp massage is important because the more blood flow that you can get to your scalp, the better. And believe it or not, there's actually been some studies to show that Botox, believe it or not, that was tested in men to relax the muscles of the scalp to allow more blood flow actually showed some improvement. So anything that's going to improve the blood flow of the scalp is going to be important for helping your hair. Getting back to androgenetic alopecia, there are other associated issues in women that need to be checked out when a woman comes in with hair loss. One is high blood pressure, diabetes, excluding metabolic syndrome. Metabolic syndrome being that constellation we've spoken about before, which is a constellation of high triglycerides, being overweight, high cholesterol, and this sort of constellation of symptoms is found more commonly, unfortunately, in women who have hair loss. And when you can correct some of these things, you can see improvement in the hair loss. Also excluding signs of hirsutism. So this is making sure there's not a abnormal hormonal response happening. So if there's abnormal hair growth in other areas, like above the lip, as an example, or the chin, or there's deepening of the voice, these sorts of things need to be looked at as well to make sure that there's no kind of hormonal issues. One of the most common missed things when it comes to hair loss, especially in women, is medication-induced hair loss. And number one that I see, at least in my patient practice, is beta blockers. Beta blockers, which are used generally for high blood pressure, things like tenormin, atenolol, propranolol, which is also used fairly commonly, Lopressor, which is another beta blocker. These are incredibly common as causing hair loss. These are very, very, very much prescribed medicines for people who have high blood pressure, especially, and they're generally safe. They don't always cause hair loss, of course, but when hair loss is in the picture, unfortunately, these types of medications can cause a significant amount of issues. And unfortunately, a fair number of general medical doctors aren't aware of that. Again, they're very safe in general, but in a small group of people, especially in women, can cause thinning of the hair. Oral contraceptives can mess with the, generally they don't cause hair loss, but they can. That's why when someone comes in with hair loss, you have to look at all the medications, seizure medicines, amphetamines, antidepressants, anticoagulants. The ones that cause hair loss are not used as much anymore, but definitely antidepressants, amphetamine-like medicines can also be a cause of drug-induced thinning of the hair. So what can we do about treatments? And treatments, there are a lot of treatments, believe it or not. And assuming you've had the right diagnosis in terms of what, that they've made sure that nothing else is going on, these are a whole host of treatments that can be used. But before we do that, let's actually look at what the general workup and blood work is to get a better understanding of this. So PCOS, polycystic ovarian syndrome, is associated with a whole host of issues: menstrual irregularities, again, abnormal hair growth in other areas, infertility, thyroid issues, absolutely. Both hypo and hyper can both cause hair problems. So definitely thyroid issues are very important to be worked up fully by your doctor if hair loss is something that's happening. Metabolic syndrome, again, which we spoke about. So thyroid, iron deficiency, vitamin D deficiency. Remember, we've spoken about zinc. Everyone should be taking 15 to 25 milligrams a day. Most multivitamins have that. A fair number of them don't have enough. Maybe they have 5, maybe they have 10. That might be okay, but you're looking more for a 15 to 25 milligram dose per day, no more than that. And some hormone tests like free testosterone that we check, and DHEAS we check. And we also check something called ANA, which is to check for autoimmune disease. So this is what we look for. Now let's talk about some of the treatments. Now, obviously, I'm not expecting you all to remember what the blood work is. The reason I mention it is just so you have a general understanding of what type of evaluations are done to try to narrow down what the diagnosis is. Now, we've spoken about PCOS, and if PCOS is an issue, lifestyle modifications are the first line of treatment. Diet, exercise, and weight loss, as well as there are some helpful medications as well that can be very, very helpful. But understanding, believe it or not, that if PCOS or metabolic syndrome are a significant factor in terms of obesity, high triglycerides, high cholesterol, then reversing those and getting rid of visceral fat, the fat that surrounds the organs, can improve things dramatically. So that is just something that I like to mention. What are some lifestyle and dietary suggestions for people who are having hair loss of the type that we're talking about? One is low protein diets. Low protein, keratin is a protein. And so if you're not getting enough protein, then there can be some problems. Now, I have seen many women who, especially elderly women, who are just not on they're not getting enough calories, and they're not getting enough protein in those calories. I've also seen people who are younger women in their 30s, even in their 20s, who have gone on crash diets, who were taking very, very low amounts of protein, who had significant hair shedding. I've also seen people on vegan diets, but unhealthy vegan diets, where they were eating a fair amount of processed foods. Generally, a vegan diet that's whole food, plant-based, that's not eating any empty calories like white flour or sugar, but are eating lots of leafy greens, beans, nuts, and seeds. Generally, they're getting enough protein. I don't see that. But for the unhealthy vegans out there who are eating French fries and bread, and that can be a situation that can lead to a relative protein deficiency, as you're not going to die from this protein deficiency, but it can yield a situation that sets you up for hair shedding. Also, essential fatty acid deficiencies. I don't see this that often. I see it sometimes in people who have eczema. Essential fatty acids are basically the fats that are found in basically nuts and seeds. The problem is a lot of people are getting these from rancid seed oils, and as a result, they're not getting pure, good essential fatty acids. So I recommend for people who have dry skin, eczema, as well as dealing with some issues with hair, especially dryness of the scalp, with thinning of the hair, both of those happening at the same time, I recommend hemp seed oil. Hemp seed oil is really good because it has a good ratio of essential fatty acids in them, a very natural ratio, and therefore it's a very good thing to have. Vitamin D deficiency, again, zinc, iron deficiency can be an issue. I think, most women, most doctors will get an iron test once a year for iron. So you should know about that. There can be biotin deficiencies. Biotin deficiencies can be seen in people who are eating raw eggs, believe it or not, because it binds the biotin. And then traction, putting your hair in tight braids can cause thinning of the hair. And sometimes that thinning can actually be permanent. Other things like hot combs and rollers can also be a problem. As far as supplements go, zinc, a mixed vitamin E supplement, it's called mixed tocotrienols, can be helpful, but definitely zinc again. And when it comes to diet, actually green tea can be very helpful for the hair. It actually, can't remember the actual mechanism, but it has something to do with blocking one of the hormones that can thin the hair. Okay, so now we've spoken a little bit about some of the lifestyle and health considerations. What about treatments? Well, believe it or not, there are a lot. First and foremost is minoxidil, Rogaine. Of course, all of you have probably heard of Rogaine. Rogaine is something that's over the counter. It comes in 2 and 5%. The 2% is advertised to women, 5% is advertised to men. The 5% does work better period. The 5%, unfortunately, I recommend the 5% in women as well, but there have been some side effects with that, in the sense that if you put it in your hair and, then you go to sleep and, you're leaning on your pillow, you can get a little bit of hair growth. Obviously, you don't want that, but you get a little hair growth in areas that you don't actually want it. Oral minoxidil at a very low dose can also be used. This would all be done with a local dermatologist. Finasteride, which is Propecia, which men take, can also be used, but it's usually reserved for postmenopausal women, because if you get pregnant on that, it unfortunately can interfere with the sexual development of the baby. So it's usually reserved for postmenopausal women. And there is some concern, if there's a family history of breast cancer, that it might not be a good idea. Spironolactone, which we use for acne, has a mild anti-androgen, anti-hormone effect. Latisse, that people use for their eyelashes, has actually been shown to be helpful as well. Low-level laser therapy. You can buy these caps that you put on your scalp, and these can actually be helpful to grow hair. Platelet-rich plasma is another thing which you can get now. A lot of dermatologists are offering that, which is where we take a little bit of blood and we can get we can spin it and get platelet-rich plasma, and that can be injected into the scalp. Some microneedling can help, and actually ketoconazole shampoo, which is an antifungal, can also be somewhat helpful. And we always have to remember that the combination of things when you're dealing with things in medicine are not necessarily additive. They might be what's called synergistic, which basically means 1 + 1 = 4. And that's important to understand, because the more you can layer in some of these treatments, especially ones that are safe and not dangerous, then it's not an issue. Constance is asking about drinking green tea. Can you drink green tea all day? Well, I don't think you need to do that. It still has caffeine, so drinking it all day could be a problem. But when you look in tea drinking cultures, and you look at not hair loss, but looking at other indicators of health, it does appear that those studies were actually looking at people who were having 3-4 cups per day, and it seemed that the more they had, the better health there was, just in general. But because of the caffeine, it's probably an issue if you're drinking caffeine all day. And Sylvia, that's right, that's what's in the green tea that works. Okay, so we've covered a fair amount of the treatments now. We've gone over the drugs, and the one I want you to remember there is those beta blockers. The advantage, just getting back to the green tea of matcha, is that when you have matcha green tea, it's the ground up tea leaves, which means you're getting the same amount of tea in one cup that you would have to get by having many, many cups of tea. So matcha, which tastes very good, is like having multiple cups of green tea because you're getting the whole tea leaf. Okay, so we've talked about the drug-induced, we've spoke about that stress-induced. One of the things about the stress-induced, the telogen effluvium, is if you're always under stress, you can have this chronic telogen effluvium, which means your hair is just never shifting into the right growth phases. And that's always going to be, and that can lead to just chronic thinning of the scalp. So you really need to pay attention to your stress and get that under control because it really does have an impact on your health. And next week, we'll be talking about stress in particular. We're going to be talking about what stress is, how it affects the body, how to determine if stress is actually affecting your body. A lot of people don't know that you can determine that to know whether or not stress is affecting your body. And we'll go cover all that next week. Okay, so we went through dietary and lifestyle considerations, and then we went through general workup. And again, one of the other things I'd like to just point out and remember, for you to remember, is again, this issue with metabolic syndrome. A lot of dermatologists and PCOS, a lot of dermatologists are not into lifestyle medicine like I am, but anytime a woman comes in and it is really dealing with obesity and blood abnormalities, you can see really great improvement by improving those metrics, by improving those things, and it can yield a lot better hair growth. All right, so let's move on now. If anyone has any questions, do let me know. We're going to move on to men. And there are things to learn here as well. And there's a fair number of things that are going to overlap. So what is concerning most to men, of course, is genetic hair loss. Before we get that, Juniper is asking about biotin supplements. So biotin supplements, unfortunately, can interfere with blood tests. They can even interfere with the tests when someone is checking to see if they had a heart attack, believe it or not. So most dermatologists are actually not I'm not recommending biotin supplements anymore because I don't want to contribute to abnormal lab tests. So Juniper, you're absolutely right. They can interfere with blood tests. The issue, I think, is that I gave a lecture, and I'll put the link on the YouTube channel, is that you can get micronutrient testing now, which includes biotin. And you can see if you're biotin deficient. You can't really get that. It's not covered by insurance, but these micronutrient tests, which I did a whole class on, can show whether or not you're biotin, whether or not you have a biotin deficiency, as well as a zinc deficiency and a magnesium deficiency, a whole host of those other things. So getting back to androgenetic alopecia, when men get it early onset, we're talking about late teens, early 20s, unfortunately, that can be also associated with metabolic syndrome, high triglycerides. And when you have those two things, again, that metabolic syndrome happening again, it's, so many people have that nowadays, unfortunately, is associated with that. And therefore, you can improve things by overall improvement in metabolic health, which we've spent many, many classes talking about in terms of making sure your body has the ability to switch between burning sugar and burning fat. When you're able to do that, you get healthier overall. Your mitochondria improve. You can handle hunger better. Your energy level is stabilized. So many things. So early onset hair loss can be reversed if it's associated with metabolic syndrome. Before we get into the treatments, I'm going to discuss some of the dietary, lifestyle, and supplements as well. Green tea, again, zinc, again, vitamin D, and pumpkin seed oil. Pumpkin seed oil, which actually I came across it some studies out of India that showed that men taking pumpkin seed oil could actually grew a decent amount of hair. The study was actually pretty impressive. So I recommend pumpkin seed oil to all men, and it also has some beneficial effects for the prostate. And there are prostate supplements that have various things in it, like saw palmetto, which we'll talk about in just a moment. Saw palmetto, it also has benefits to the prostate, and so does pumpkin seed oil. So as an example, there's a supplement from a Life Extension Foundation that has pumpkin seed oil and saw palmetto and a few other things for prostate health. And the doses that they have in that would potentially be good for hair as well. And it's no surprise, really, because the same hormone that causes the prostate to grow is also the same hormone that causes the hair to miniaturize and shrink. And so those treatments that are going to help the prostate, while they aren't going to be perfect in terms of growing hair, definitely can be helpful. Okay, before we get into the many treatments, we'll talk briefly about the workup. Most dermatologists do not get blood work for men who are coming in with a male pattern hair loss. However, I like to get a general, some general tests. Juniper is asking about oral collagen peptide supplements. So you can, oral collagen peptides can help with the skin. The data for those are more for the skin than for the hair. So, okay. General workup, I sometimes get DHEA, testosterone. I get thyroid, iron levels as well. Most dermatologists do not, but quite frankly, it's very uncommon, believe it or not, for me to see a good amount of men. I see a lot more women who come in with hair thinning than I do for men who are asking. Unfortunately, for a fair number of people, men that is, they sort of feel like they have hair thinning, and unfortunately, there's nothing they can do. But unfortunately, there are a fair number of things that can be done. And I think I like to get some of the blood work, especially, again, if I suspect metabolic syndrome, I'm also going to be getting a lipid panel, triglycerides, and blood sugar as well, because this gives me an overall indication of their overall health. And quite frankly, everything affects everything else. And if you're going to be able to improve someone's overall health, generally you're going to see some improvement if that ill health is contributing, which it almost always is. Okay, so let's go into the treatments. There are many, and then we'll call it an evening. And people don't realize that there are so many treatments. Now, sometimes in medicine, there's sort of a saying that the more treatment something has, it means none of them are all that effective, because if you had one treatment that worked, then there wouldn't be any more research trying to find a whole host of other treatments. There is some truth in that, because obviously we don't have this amazing cure for hair loss. Nonetheless, as I spoke to you before, there is that concept of synergy where 1 + 1 = 4. And therefore, I always counsel my patients that if they want to try to retain their hair, as they should combine as many things as they possibly can, assuming that there's not much of a problem with those medicines. Now, topical minoxidil is a must, 5%. I actually combine. There's now compounded topicals that are readily available. The one that, say, I use and prescribe to my patients has 6% minoxidil, which is more than the 5% over the counter. It also has tretinoin, which is retin A, and it has topical finasteride as well. There are other compounded topicals that include caffeine. Caffeine has been shown to help a little bit topically. And Latisse, the eyelash medicine, that can cause some pigmentation, to darken the pigmentation to the hair, but has actually been shown to be helpful as well. So when it comes to topical treatments, I prescribe through a compounding pharmacy that advertises quite a bit. They're called HairStim. I have an account with them that I use to get my patients medicine, and that combination topical works pretty decently. Obviously, you have to realize, and a lot of people are put off when I say, well, when you start this, you have to use it, and you have to use it forever. And the reason you have to use it forever is because if you're genetically predetermined to lose your hair at a certain age, and you've been able to delay it with the use of medicines, when you stop, you're just going to go to where you would genetically be predetermined at that age, assuming, overall health and everything. And that means that if you're doing the medicine, it's working really well, and then you stop, you could lose a decent amount of hair. And for some people, they just don't want to do that. For most people who understand the context and what I've just been explaining, then they sort of get it and they understand. Same thing goes with the other medicines, unfortunately, because if you're combining them, you're not necessarily sure whether or not they're going to be, which one's working the best. Finasteride, Propecia has some controversy to it. There's 2 to 4% of men that have reported sexual dysfunction. And unfortunately, for some of these men, it's permanent sexual dysfunction. And some people, even though the risk is low, and not all of these men have permanent, there have been reports of permanent sexual dysfunction, as well as some reports of depression, a whole host of things. It's hard to parse out exactly what is going on there, but I always tell my male patients at 2 to 4% risk of sexual dysfunction. Hair transplantation, the low laser light therapy, again, the PRP injections are becoming a lot more popular these days, and the studies are pretty decent. I spoke a little bit about saw palmetto. The studies are plus and minus. That's why I put question marks. But quite frankly, for any aging male, I do think that a prostate supplement that has saw palmetto and pumpkin seed oil would be generally beneficial. So I do recommend that. And we spoke a little bit about Botox, and the reason they think that might work in the limited study is, again, because it relaxes the muscles of the scalp and allows more blood to flow into the scalp. As far as supplements go, again, green tea, zinc, vitamin D. Remember, you should know what your vitamin D level is, and pumpkin seed oil. So we covered some general hair loss suggestions. We covered dietary and lifestyle suggestions, both for men and women. We went into drug-induced hair loss, things to look out for there, as well as dietary suggestions when it comes to things like, talking about essential fatty acids. We spoke about protein, making sure you're getting a good amount of protein. Again, it doesn't have to necessarily be from an animal. It just means that you need to get a decent amount of high quality, whole plant-based foods, as well as the situation of just making sure that you're metabolically healthy. You're not dealing with situations where you have high blood sugar and high triglycerides, high cholesterol, and abdominal obesity. When you have those, unfortunately, that's going to make everything worse. And therefore, that will put you in a situation where even if you had a small genetic risk, unfortunately, your risk could actually be, your hair loss could be more than it should be if you were at optimal health. So next week is episode 77 of Wednesday Night Live. And again, we're going to be speaking about stress. And we're going to talk about the differences between acute stress and chronic stress. We're going to talk about how to determine whether or not your body is being affected by the stress that you're under. We'll talk about lifestyle suggestions. We'll talk about some unusual stress reduction therapies and treatments that you can do at home that you may or may not have heard of. And I think ultimately we're living in an incredibly overstressed environment, a lot of us, especially with COVID and such. And I think it's important for you to really dial in and make sure you can dial down the level of stress that you have. And unfortunately, some people just aren't even aware, they're very not in touch with their body these days, and they don't know. They may be eating everything right. They may be feel like they're doing everything right, and inside they're a boiling cauldron of stress, and that isn't being expressed. That's being, not handled properly. When we are not aware of that happening, it can lead to an enormous number of health problems, even if you're doing everything else right. So thank you, everyone, for your attention, and hope you enjoyed tonight's class. And I look forward to seeing you next Wednesday night at 8 p.m., and we'll be talking about stress. Have a great night, everyone. Bye-bye.